You're listening to the podcast between doctors and friends. Today, we'll be talking about HRT, hormone replacement therapy. Margaret, you had a question about this topic.
I do. Good morning. Thank you so much for having me. I am a senior woman. I am coming up on my 71st birthday shortly, and I'm having an awful time with sleep. And I've reached out first to friends who are a little bit younger than me, like in their early 60s, to see if they have approached or thought about or are currently taking hormone replacement therapy. And I have found a few that are on hormone replacement therapy, particularly the patch. And I guess you supplement that with a progesterone pill as well. And they have found that their sleep has dramatically improved, along with some other side effects. And so I reached out to my doctor, my gynecologist, my endocrinologist, and also a woman who has joined a practice with a doctor who specifically deals in hormone replacement therapy. And I'm getting conflicting opinions about whether I'm too old, whether I've passed the age to take hormone replacement therapy. And just as a sidebar, right after I entered menopause, I did 1 month of bioidentical hormone replacement therapy. Didn't like how I felt, so I went off of it. And that was, I guess, my late 50s, early 60s. So today, my question basically is, how can I get better sleep, and would HRTs help me?
So definitely insomnia is a very common side effect of menopause and one of the symptoms that patients most complain about. And honestly, we'll get conflicting opinions from multiple doctors because it's not a set treatment plan for every patient experiencing menopause. It's not like, oh, high blood pressure. We have very strict criteria. If your blood pressure is this level, you start on this medication. If it doesn't work, you go to another medication. It's very standardized. But menopause is really more of a nuanced type of approach because every woman experiences differently. Some women may just, stop their periods and not have a single hot flash and go through it with, easy breezy. Other women have years and years of multiple symptoms that are affecting every aspect of their living. So it really is more of the art of medicine, treatment of menopausal women, versus more of a scientific approach. So it is understandable. The more doctors you ask, the more opinions you're going to get, and some of them may be contradictory. Some people may not have the history or the education and experience in treating menopausal women, whereas other people may have a lot more experience and a lot more readily set to treat you for that. But as far as insomnia goes, we really need to see if you're having sort of an estrogen depletion type of symptoms when you are having that. So are you having like hot flashes or night sweats during the evening?
No.
No. Any other symptoms of menopause that you're experiencing? Mood swings, irritability, vaginal dryness?
The vaginal dryness. I use estradiol inserts.
Okay. So you're already taking that.
Yeah, been doing that for years.
Yeah. So, and have you tried we also want to look at like insomnia as other root causes to it as well. and having, evaluation done for things like depression and anxiety, medical issues such as that. So having that evaluated is good also. But as far as to your question, does hormone replacement help with insomnia? As a gynecologist, I do a lot of hormone replacement, and I have given it to patients where their number one complaint is insomnia, and it generally does, I think, help with that. And it's something that's worth trying. I would counsel you, if you were my patient, that if you have any of these symptoms, then at least we can try them for give 90 days trial period to see how you feel on those medications, assuming that, we discuss the side effects and the risks of taking it and go through your medical history and make sure there's no contraindication, then we can go ahead and do a trial period and see how that works for you. Um, you know, Before we do that, I would talk to you about, what is your bedtime routine? Are you, not scrolling on your phone at night? Are you sleeping in a quiet, cool, dark bedroom? Are you maybe, listening to some calming music or doing some sort of relaxation technique before bed, yoga, practicing mindfulness, paced breathing, even some exercise before bedtime? Are you limiting your alcohol, limiting your caffeine? So kind of looking for other causes of it, but if not, then I very much think that hormone replacement can help you if all other causes are eliminated.
Thank you. Yeah, all those things you mentioned, I've been addressing. Some better than others.
I have to echo what Dr. Ray has said, that I feel that insomnia is a much broader category. It's sometimes very difficult to manage and sometimes not. But I from a primary care perspective, the first thing I would not do is say, hey, we need to replace your hormones, particularly this far, after menopause. Do you feel the insomnia is something that's recent or something that has been there for a much longer period of time?
A longer period, yeah. It's been there for a while. I mean, not before menopause, but definitely it's been there since, for sure.
A lot of the literature supports for just insomnia in general. Once again, I understand that this is, discussion about hormones is really cognitive behavioral therapy to try to improve sleep. Unofficially, it's been my experience that a lot of people who have difficulty sleeping have some underlying anxiety issues, which is extremely common. And when those are addressed, and that's not directly related to the CBT for sleep, that can make a big difference in somebody's sleep quality. And then the general advice I give, and once again, I don't know your personal medical history and all those things, is just a lot more intensive exercise that can really help a lot of sleep issues. And it needs to be timed at the right time. Like that would be like do that earlier in the day and not close to bedtime. Sometimes it's activating for some people.
Yeah, I agree. Yeah, I do some pretty good exercising, first thing in the morning. Well, after breakfast, actually. But yes, but this is all helpful information, and I must say a lot of what I have already researched. I just wanted to add. I don't want to take up too much of this conversation, but that what has shied me away from taking HRTs would be the side effects and the increase. I know early on there were a lot of big research reports, and that came out about the increase in cancer, heart attacks, so forth, and that apparently more recently some of those, they've done some new research, and that I'm not sure that from what I've heard that some of that has been debunked and that have found that to not be true. So I don't know if you two have opinions on that.
Right. So you're referring to the Women's Health Initiative study that was done back in 2000 that showed an increased risk of breast cancer, heart attack, and stroke in people taking the hormone replacement therapy. And they stopped the study before it was completed because they started to notice an increase. But when they collected data over time, and they realized that those numbers were really insignificant, and in the correct patient population, as long as a woman is getting her mammograms yearly, keeping up to date with her, primary care physician visits, checking blood pressure, checking cholesterol, there's really a very minimal risk associated with taking the hormone replacement therapy. So again, it's like any kind of medication that you take. There's always side effects. There's always risk to taking them, and you just have to make sure that the benefits outweigh the risks. So previously, we used to start every 50-year-old woman on hormone replacement therapy. And now we sort of look at their symptoms and what they need to address and what they want to accomplish to see if they need the hormone replacement at all. Like I mentioned before, I've had several women who have gone through a very easy menopause where they just sort of periods stopped and they didn't really notice a difference, and they're still, sleeping, no hot flashes, no symptoms whatsoever, and they, may not require hormone replacement. But some people who do have severe symptoms, they're having 20 to 30 hot flashes a day. They're maybe like an elementary school teacher, and they're in the middle of teaching their class, and they're having a hot flash and having to take off their jacket and their sweater, and the kids are laughing at them, or they're uncomfortable, or they're a corporate, executive giving a presentation and having a hot flash in the middle of it. It's affecting their lifestyle. It's embarrassing, humiliating, and it's not conducive to them living their lifestyle. Then with them, they want anything that's going to help them because they can't keep living like that. So the very minimal increase of risk from the hormones, they are willing to accept. So it's different in everybody, and everyone has to be individually counseled.
Thank you so much. I should pass the mic at this point. Thank you. That's incredible information. Thank you very much.
No problem. You're welcome.
No, I mean, this is good because we were just talking about insomnia, right? So 2 days ago, I couldn't sleep well. And then my friends made me walk like over 10,000 steps yesterday. And last night, I slept so well.
It absolutely works.
Yeah, go on.
Well, the advice I generally tell people, I mean, once again, insomnia is a really huge thing, and it's very vague, and, it could be from a million different things. One of my previous partners was a sleep medicine expert, and we used to talk a lot about insomnia management because it is such a common primary care complaint, and it's frustrating. People always want to get to the root of everything, and I can't get to the root of everything as much as I would like to, and as much as I'll try, I can't always. And when you refer to CBT and cognitive behavioral therapy and all those things, they either won't go, or their insurance won't cover it, or something like that. It's just kind of a mess. But I do think that a lot of what happens to us we just live in a stressful society. There's something 24/7. There's always something that we'll worry about. I think and I will once again defer to Dr. Ray on this, but I mean, I think menopause comes up at a time for women where it's just really not convenient. The kids are old enough to be a problem. You're mid-career and trying to figure out what to do. And now your parents are older, and now they have their own health problems that are a source of stress. And so there's just a lot that is heaped on at a difficult time, I think. And, but insomnia is, I think responds really well. What I usually tell people is just work out so much that you're exhausted, and you just fall into bed exhausted. That works.
Yeah, I think if you have a very busy day schedule, also, wake up earlier in the morning. So if you're sleeping till 10, 11 o'clock, maybe you're retired, you're sleeping till 10, 11 o'clock, then it's going to be harder to go to sleep at a reasonable time. But if you're waking up early, starting your day with maybe a little exercise, having a busy, productive day, in the evenings, adding some more exercise to that, that I think will definitely help to change your sleep schedule. I think that a lot of people are on very difficult sleep schedules. They don't have, exact times that they go to sleep. And I think a lot of it too is the nighttime scrolling on your telephone. You're
Mhm.
always on the screen scrolling, reading about, what's happening in the world or on some social media or even playing games. My mother in her late 70s is addicted to these little Candy Crushes and the video games on the phone. Slowly, and so you have to kind of put that down because um, it's engaging your brain so much that your brain is going to have trouble shutting off. And
Yeah, the light stimulation, like I think it's important to start to kind of get your, the thing, that we always discuss when it's like sleep hygiene,
Uh-huh.
start turning down the lights, start getting your body like signaling to your brain that we're going to get ready to sleep. And all, you can Google that in any reputable website. It's a bunch of, tips on how to improve your sleep. Like all those things have to happen. And it's also, I've also seen a lot of people who are retired who like, they don't have a regular sleep pattern anymore, or they stay up all night. They're up all night and sleeping all day, and they're wondering why their sleep is fragmented. I
Mm.
don't think we're really designed to do that.
Blame Dr. Foz for texting with me late at night, and there's and 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 B here, who's like, we're sharing like Bernie Doodle, like, photos of dogs late at night. So,
Oh, that's right. It's always somebody else.
M, you have a question? You have your hands raised.
it's always the late time texts that kind of keep people up awake as well. And so I think putting your notifications on silent at a certain time is very helpful.
I know because Dr. Foz works late, long hours. She gets home so late, and so we're texting. And
Well,
I'm
you know
guess
what I think? Oh, sorry. Go ahead.
go
Go
ahead.
ahead.
No, go ahead. Go ahead.
Well, just thinking about this, I think really what happens is another really important part about insomnia, and yes, staying up late, too late, and all those things um, is when you go to bed. Like a common time when people complain to us as medical professionals about anxiety symptoms, like palpitations and nervousness and all those things. It's often when you're winding down, when you're getting into bed and the lights are off and you're laying there quietly because it's quiet, probably potentially for the first time all day in your
Uh-huh.
life or in your day, and now your mind has a chance to wander and to think about all those things that worry you or concern you. It's that period of quietness, and I I think it's important to address those things in your life, and I think that's where the CBT comes out, and just kind of acknowledging, yes, this is giving me stress. I'm upset about this or that or the other, and I think just kind of helping the mind clear itself will contribute to better sleep.
Hi, Dr. Fuzz. Hi, Margaret. Thank you for the great questions. And hi, Dr. Ray. So this is M. And so I was talking to Dr. Ray yesterday as we were walking like 10,000 miles with our lovely host here and our
Wait,
other friend.
wait,
And I
wait,
was
wait.
telling
Wait. It's 10,000 steps. Not 10,000 miles.
It probably felt like 10,000 miles.
yeah. Well, yeah, you're right. 10,000 steps. I did feel like 10,000 miles. And also, and Lily's Garden lover here. So I too play with those games at night. I do feel that if I'm on the phone late at night, it's going to keep me up. But Margaret, you asked all the questions I wanted to ask because I too have trouble with my sleep because I am hot. And so I have two questions. I was talking to another friend who's a professor, and she was like, "Hey, I got these HRT patches. They're such a game changer." And when I went to speak with my OBGYN, she was like mentioning pills. So is there a difference between the patches and pills? And then my second question is, and I forgot to ask you this, Dr. Ray, yesterday. I know this is going to sound crazy, but like pajama specific pajamas fabrics I've been looking at, because sometimes I'll go to the store and I'm like, oh, these are so cute. I want them, and I'll buy them. And then I'm miserable at night because they're super cute, but I am like drenched in a pool of sweat, versus like maybe buy a different fabric that I can sleep in peace. So those are my questions.
So for the first part of it, as far as the how hormones are dispensed, they can be dispensed in a variety. They can be dispensed in pills, patches, injections, creams, all of those, pellets. So those are all different ways that you can get your hormones. The pills are the most common, and I think the easiest to prescribe and the easiest to get covered. So an estrogen pill, a
Mm-hmm.
progesterone pill. Sometimes you can get a combination. Estrogen progesterone tablet. The most common one is something called Prempro. So remember that if you have a uterus
Mm-hmm.
still,
I do.
so the basic tenet of hormone therapy is estrogen replacement and progesterone replacement. If you still have a uterus, you need to take the progesterone replacement in order to prevent the estrogen stimulating the lining of the uterus and becoming cancerous. So the progesterone that you take is really protective to the uterine lining as far as the estrogen stimulation goes. So that's why you need to take a combination pill or take an estrogen and progesterone separately. Now, if you don't have a uterus, if you've had a hysterectomy and are having the symptoms of menopause, you can just take estrogen by itself. You don't need the protective balance of the progesterone. So for a woman like yourself, Em, who still has a uterus, then you would need estrogen and progesterone. So you can take a separate estrogen tablet, you can take a separate progesterone tablet, or you can take a combination where it's just one tablet that you take together that has both of them in place. Or some women find the patch with to have less side effects. The tablets are obviously absorbed by your intestinal system, and sometimes they can give you some more side effects of upset stomach and nausea, whereas the patch is absorbed transdermally through your skin. And it will give you less of those side effects. So, some women will put an estrogen patch on, but then take the progesterone pill. Some women don't like the patch. They don't like the sticker on their skin. They're sensitive to it. They feel like it falls off. Maybe they swim a lot and they're worried it's going to come off when they swim, or they just don't like the look. They wear a tank top. They don't want people to see it. They don't like to put it on their back. A variety of reasons that somebody would not want the patch, and a variety of reasons that somebody would want the patch. So you can get it in either form. They also come, like I said, in creams that you could use as well, but the most common are going to be the pills or the patches. There's also a vaginal ring. I forgot to mention that. You can get estrogen in the form of a vaginal ring that's inserted into the vagina as well. So there are many different options. It just really depends on the method that you prefer.
What age does this normally start for women?
The average age of menopause is 50 to 51, and some women will start experiencing perimenopausal symptoms in their early 40s. So some women will come in with a lot of these symptoms when they're in their early 40s.
Dr. Ray, do you feel that there is any difference in safety profiles versus versus or patch versus pills when it comes to the estrogen replacement component?
As far as like risks for long term, like heart attack,
Thromboembolic disease.
Yeah, I think the patch has probably a slightly higher, a better safety profile than the pills do, but in general, they're considered equally safe.
Great, thank you.
And so you're saying average in the early 50s, up to what age? Like you stop when?
Well, most symptoms, according to textbooks, last about 5 years. So when I start a woman on her hormone replacement, I'll say something to the effect of, let's start you on it and we'll continue on it for about 5 years. And at the 5 year mark, we can just have a discussion about stopping based on your symptoms. Most women by that mark have sort of gone through the menopause. They don't have the symptoms. They're okay stopping. But some women continue to have symptoms for years and years, and they might go 10, 15 years of having the menopause symptoms. So there's no real end point. There's not a, oh, it only lasts X amount of time. So it can last longer in some people, it can be shorter in other people. And some women feel so good on their hormone replacement. They're having, the energy, they're not having the hot flashes, they're sleeping well, their skin is great, they don't have, hair loss, any of those symptoms, that they do not want to stop their hormones. So even if we've hit that 5-year mark, they do not want to stop their hormones. They feel good on it. And as long as we have a discussion and we have an agreement and they understand the risks and benefits of continuing hormones long long term, and they have, you know, an informed consent, so to speak, then I have no problem continuing them on it, because they feel so good and they're worried that they're going to go back to feeling awful when they stop their hormones.
Does HRT affect like osteo, or is that completely different? The calcium and
Right. Well, the symptoms of menopause are varied: hot flashes, mood swings, vaginal dryness, irritability, night sweats, bone loss, dry skin, pain during intercourse, brittle hair, you name it. Your body goes through so many changes during menopause. And so a lot of these can be improved with the use of hormone replacement therapy. So definitely can help that. Specific with osteoporosis, taking an estrogen will definitely help minimize your bone loss, as well as replacing with vitamin D and calcium supplements and doing weight bearing exercises. So, again, that goes to the importance of exercising with these menopausal women, and doing weight bearing exercises, putting that stress on your bones to help improve or minimize the bone loss.
okay. Well, we got our friend B here. B, go ahead and mute yourself.
Yeah, hey, thanks, Dr. Ray. What about weight gain? Right? During menopause, you start to gain weight and you're like trying to figure out how to lose it. And no matter what I do, like reduce my food intake, exercise, any of that, it's not working. I just can't lose the weight. Would
Right.
HRT help?
Well, weight gain is definitely a part of menopause for sure. And we see that because metabolism slows down. Hormone changes during the menopause, the estrogen falls, and it causes a shift in the storage of the fat cells, and the metabolism, like I said, slows down. Your calorie needs are less during menopause as well. So hormone replacement therapy, I don't think will affect weight gain directly. It's not something that's going to shift that from happening as far as I know, but it really is something that has to be do more with your nutrition, your physical activity, all of that. Hormones can possibly help to redistribute the the fat retention in your body and reduce some of the central weight gain. So like your abdomen area, that might be a little bit less, but it's not meant to be weight loss therapy, and it's not meant to be something as far as weight management goes.
Agreed. And I also have to just reemphasize that just because somebody is menopausal, perimenopausal, doesn't mean they're a candidate for hormone replacement therapy. It's not like I'm not sleeping good and I put on some weight, I need hormone therapy. It you may not be a candidate. You may have medical contraindications.
Oh, that's interesting.
Right. Yeah. So again, with the weight gain, you have to look at your nutrition and what you're eating. You may not be able to eat the same things that you did premenopausal. So you need to, have a little bit more balanced diet, more protein, because menopausal women lose muscle mass faster. So you want to increase your protein in your diet, limiting your sugars and your carbs as well, and getting that physical activity in there, doing that strength training with the weight-bearing exercises, aerobic activity. All of that is going to help, again, with the sleep and possibly the stress. And we all know that if we don't sleep well, lack of sleep can also lead to weight gain. It has
Absolutely.
with the cortisol levels and the nighttime cravings that we get. Oh, it's 1 a.m. I can't sleep. Let me go downstairs and get a chocolate cake. So improving your sleep, improving your stress. Again, mindfulness, yoga, meditation, exercising, stress management, all of those things will help. But taking hormones to minimize your weight gain, um, that is not going to work, and that's not really a use of hormone therapy.
Right. That's not recommended. I would like to emphasize that I don't think anybody should go see their doctor and say, hey, I've put on some weight. I think I need to be on hormone replacement therapy. That's not really an indication.
Wow,
Right.
that's good. Okay, we got our friend Margaret here.
Hi, thank you. Question with one of the points you were just discussing. Going back to what I had said earlier, in my research, I had looked into a nurse practitioner who has now joined on with a practice that deals specifically in HRT. Their approach after you talk to them is to do a tremendous amount of blood work on you for testing. Are you in favor of that? Would that help decide whether a candidate, I'm a candidate or anyone's a candidate for HRT by doing a lot of blood work?
I think the blood work for hormones is really not helpful. I think in general, most doctors would, when we talk among ourselves, it's one of our bane of the existence when the patients come in and ask, I want to get my hormones checked. Because hormones fluctuate their time period. So even, a menstruating woman, her hormones are going to fluctuate so much depending on where she is in her menstrual cycle. So I could check one hormone level, like say her estradiol level, in the luteal phase versus the follicular phase. There are going to be so much fluctuations within that. The hormone blood tests are just a snapshot of what your hormones are doing. Hormones rise and fall throughout the day. So it's really not helpful to let us know. Everyone wants to get their hormones checked to see if they're in menopause, but it's really your symptoms that we're going by. If you're telling me that your periods are irregular, you're having hot flashes, vaginal dryness, you can't sleep, you're having night sweats, to me, you're perimenopausal. It doesn't matter what your hormones say. If your hormones come back and they're all normal levels, I'm not going to ignore the symptoms that you're telling me. And I'm not going to say, well, your hormones are normal, so obviously you're fine, so come back in a year. You're telling me you're having these symptoms. These symptoms are menopausal symptoms. So let's address those symptoms and treat you accordingly. What your hormones say don't really help. Now,
I agree with that.
Yeah.
A lot of people will, check your hormones and say, oh, your estrogen level is at X, we need to raise it to Y. And that doesn't really, is not really helpful. And people who do like bioidentical hormones, they'll do like saliva testing and check your hormone levels that way and try and adjust it. And people will say, like, I have to go in and get my hormones checked on a monthly basis so they can keep adjusting my medications. I really think that is not necessary at all. All of these hormones that they test it's not necessary. We go by your symptoms. What are your symptoms? How can we treat your symptoms best?
Yeah, I agree. It doesn't necessarily shed a whole lot of information on what's happening. I mean, and then the other thing to understand is I think the layperson doesn't always realize that I don't have a test for everything. And even if I have a test for something, it may not be as clear of an answer as somebody expects. The classic example is what I always use is a pregnancy test. If a test is positive, we all know what the issue is. You don't need to be a doctor to know what it is. If it's negative, we all know what the problem is not. But that is not really how it works for a lot of medical tests. They're not as specific as people expect it to be.
I was going to say the popular one now that everyone wants to get checked is cortisol. And I think Dr. Foz, you may have probably gotten a ton of these questions about, Oh, I wanted to get my cortisol levels checked. Well, cortisol fluctuates so much versus 6 a.m. to 6 p.m. Your cortisol levels are going to be very different. And it's, whatever's on TikTok and trending right now is what they're coming in to ask. And it's not.
Oh, that's what explains it. Getting tons of requests for that, and I shake my head. I think it's a little ridiculous, and it's often in people who are like really stressed out and just kind of not doing well because of stuff in their lives, and they're like, "I'm worried, my cortisol is high." I'm like, "Yeah, it probably is because you're stressed."
Well, thank you for saving me a lot of money. Thank you. Thank you.
I will make a comment on that. There are a lot of nurse practitioners and clinics that will be like, come check your hormones and want you to spend so much money on these hormone panels. And then they interpret them, in a wrong way. They'll look at it and say, oh, your estrogen is low, so you need to do this, or your progesterone or testosterone is this, and we need to do that. It's not a way that you can interpret them, and it really is a money grab. So if you go to any real legitimate doctor, to ask these questions, they're gonna not do it, because it's not necessary. And unless we're looking for something very specific that we need to know, then it really is not worth your money and not worth your time. And
I agree.
There are clinics popping up everywhere. There are ads everywhere to get your hormones tested. There are all these things to get, to spend your money on, to get your money, because they're preying, like as everyone else does. They always prey on the weak and they prey on the scared. And these are women who just don't feel good and something is wrong and they don't know what's wrong. And they see an ad that says for $400, come get all your hormones checked and we'll tell you what magic pill you need to take, and they sign up and they go do it. But there really is no benefit, no medical, scientific backing to what.
I completely agree. That's like a lot like the our discussion on a lot of herbals and supplements. It's like you create a fear, or oh, you're deficient in X, Y, or Z, so that you then go buy it. And it's the same thing with, come get your hormones checked. And it's interesting. It's like I've never understood why. I work with a really good endocrinology group as my specialist consultants, and very, very good, brilliant doctors. They don't recommend anything near what the local bioidentical clinic will. And it's like, why would a really well-educated physician who's really good and, and a leader in their field in hormones and glands and all those things recommend something totally different than some bioidentical place that's pushing their pellets or whatever? I mean, that doesn't that make anybody think twice?
So you're seeing an increase of patients will just come to you and say, I want my hormones checked or my cortisol levels checked?
I get that all the time.
Wow.
Yeah, I get at least 3 or 4 patients a week saying, I just wanted to get my hormones checked. And my response is, well, which hormones do you want to get checked? Because there are over 1,000 hormones. So which one am I supposed to be checking? And they're just like, I don't know. I just don't feel right. I think my hormones are off. And then I'm like, well, what are you feeling? Let's go down what your symptoms are, because there's no hormone test. There's not a blood test called hormone test. You have to list out every single hormone that you want to get tested. LH, FSH, TSH, estradiol, progesterone, testosterone, DHEAS, multiple types of hormones that you can get tested. So what is it that you're looking for? Are you having menopause symptoms? Let's talk about that. Are you having maybe low thyroid symptoms? Let's talk about that. So you have to go more by what is going on with you and what is happening to you, rather than just requesting a blank panel of hormones to be tested, because their hormones are, right, Dr. Foz, there's probably, hundreds and hundreds of hormones that can be tested.
There's tons of hormones, and it's frustrating when you try to explain that to patients and they don't care. They're just like, I want this, and you're just like, it doesn't make any sense. And then it gets into something in medicine. It's called pretest probability. It's like you have to look into tests are not 100% specific for what you want. Once again, they're not yes, no, black or white, and it's often an entire clinical picture. And just like Dr. Ray was saying, like you don't it's not, you don't just, there isn't, you just don't send everything on everybody just to check. That doesn't make any sense at all. And then what are you going to do if you send enough tests? Statistically, if I send 5,000 tests in a perfectly normal, healthy human, I'm going to find something outside of the range. That's just the statistics, because and then now you have somebody who sees red on their lab report and they are spiraling in anxiety and panic for reasons that are not necessary.
Yeah.
Hey, Dr. Fosdick, Dr. Ray, this is Em, and I think the reason for that is because I read so much in Google or in magazines about one should get this or one should get that, and these are not from experts, especially like, for example, entertainment industry. We have, superstars telling us every day, oh, okay, well, you should do this, you should do that. And people believe that. So how do you address that I imagine every day you get inundated. Well, so-and-so says this, so-and-so says that. And by no means they have medical background.
Oh boy.
Sorry, I opened that kind of word. Okay, so Margaret, this is why I go to my girlfriends, Dr. Foz and Dr.
Yes.
Ray. I have like 1,000 questions, but then, I asked these questions because sometimes I see these non-medical individuals who are, famous and spout these things. And I think, well, okay, let me ask Dr. Ray and Dr. Foz because, it's almost like they're influencers, but is it appropriate? And it may not be applicable. So I was just curious about that. So I think a lot of times, go ahead.
I think that comes down to, well, first of all, it's popular, right? Let's talk about, it's like politics, right? It's like, whatever entertainer follows this, recommends, or says this about whatever political belief that they have. And then you have, whatever firestorm or not that comes from that. I think it's not necessarily bad to talk about things. I think when it's bad is when it just triggers massive anxiety. Like, don't freak everybody out. Remember that medicine is very individualized, and a lot of it depends on someone's hormone history, right? Or excuse me, his medical history. We're talking about hormones. Once again, not everybody's a candidate for hormone replacement. Yes, you might have hot flashes. Yes, you might have night sweats. Yes, you might be having all the other symptoms, but you're not a candidate for X, Y, Z or reason. So we can do other things to make you feel better, but we can't do that. Like, you are not a good candidate. And that's the same thing with a lot of other stuff. It's like things have to be individualized. And then this is for me, the crux of the matter is go talk to your physician and then really, take what they have to say at heart. And if you can't do that, then you need to find another physician that you do trust, because it comes down to a question of trust. Like, I really can't stand it when somebody who comes to me and I'm doing the best I can to protect their health because that's my job. And then, they're arguing with me because some fool on TikTok said something and I'm just like, all right, clearly you don't trust me. You can leave. I've done the best I can. And you think that I'm giving you wrong advice. You can now go.
That's true.
And good for you, because that's what I'm talking about. It's like someone from TikTok or this, but you are so clinically trained. I mean, I personally know your backgrounds and trust you. So thanks for sharing that, because I can only imagine how tough it is for you when you have people come and you are so trained in your fields and specialties, and then you're dealing with people like sometimes like me saying, but what is about this or what about that? And just because I'm ignorant to the fact I don't have your training. So thanks for that, Dr. Foz.
Well,
appreciate it.
We are always open to discussion. I will tell you why I think X, Y, or Z. It's not like we don't welcome the discourse. Absolutely, that's fair. I'm glad when I meet somebody who's interested in their health. But when it becomes the trust of like social media and Google versus, hey, I don't think this is a good choice, or you should try this first or something, it's a little absurd.
Yeah.
And then I think it becomes just like trend following.
And
that's not always in somebody's best interest.
Yeah, I do the same too. When they come in and they say, I read about this, or I saw something about this test being done, or this hormone should be done, I'll talk to them about, what it is that they saw, what is it that they have as far as their symptoms go, what is it that they want to accomplish, and I'll let them know, that recommendation really isn't, medically supported. It's not scientifically sound. It's something that we don't do. If they want to argue with me and they want to get it done, I just say to them, this is simply my opinion. I can only tell you from my years of experience that this is not something that I would recommend. not something that I would do. And even tell them, if you were my sister, I would recommend that you not do this because it's not something that is, medically justified. But if it's something that you insist on doing, I'm sure there are plenty of providers out there that would probably help you. And then you can, go ahead and seek what you need to seek. But, if you want to trust what I'm telling you, then this is not what is necessary, in your situation. So again, it comes down to education. Everyone's going to see something. And we do that with all industries. If you have somebody who, like maybe in the entertainment industry, and you hear a rumor about a celebrity, you might ask them, hey, do you know anything about this? And they'll be like, oh, no, that's not true or something. So it's good to ask. It's good to ask, come in and say, hey, I've been reading about this situation, and do you think it's something, what is your opinion on it? Do you think it's applicable to what I'm going through? And I think any doctor would be happy to, give you the education on it and talk to you about whether or not it's reasonable.
Wow.
Absolutely. It's about that communication and tailoring things to somebody's particular concerns versus their actual situation. But it has to be a discussion, and not everything that's on social media is applicable to every person.
That's why we have this podcast.
Right. And I wouldn't hesitate to bring up a concern to your doctor because they've likely heard it from another patient as well. And they can just simply tell you whether that is a legitimate concern or not a legitimate concern. So don't be embarrassed to talk to your doctor about, something that you saw that you think might be helpful, because in some cases, maybe it will be, but you never know unless you ask them. But a lot of times, like everything else we see on social media and TikTok, it just gets blown out of proportion as to how helpful and wise it is to follow that advice.
You said that more patients are coming to you saying, I want to get these things tested. Or how does insurance play into that? Is HRT covered by insurance?
So most of the blood tests will be covered. Patients all have different types of insurances, different HMO, PPO plans, government assisted plans. And so everything is covered differently, but majority of labs are covered. They will have a potential copay or a deductible that they might have to pay for the lab. So they all need to be aware of that. As far as hormone replacement therapy being covered by insurance, that is a whole can of worms. Insurance companies, just don't really support women's health a lot. For example, there's a medication called Premarin, which is a brand name of estrogen, and the combination pill called Prempro, which is the estrogen and progesterone, and the vaginal cream is Premarin vaginal cream. These medications have been out on the market 60 plus years. I learned about it way back in the 90s when I was in medical school and doing my training. So these are tried and true medications that have been out there and are working well for everyone, but insurances don't want to cover it. The Premarin vaginal creams can be up to $200 to $300 a month for some of these women without insurance.
Wow.
And the insurances are very difficult sometimes in covering. They want to cover only generics. They want patients to have failed certain trials beforehand. So it is sometimes a difficulty getting insurance to cover certain types of hormone replacement. So that is a difficult topic. And some insurances are much better than others. Some insurances will cover them easily. Some insurances don't cover them at all.
Yeah, it's quite variable depending on somebody's insurance. Absolutely, I agree with that.
When it comes to menopausal HRT, one topic is women's libido. Libido, is that how you pronounce it?
Libido.
Goes up, goes down. What's up with that?
Goes down during menopause. Yes, definitely libido goes down, and that's been tried and true and shown to happen in many women because of the lack of estrogen, progesterone, testosterone that happens. And so, yes, hormone replacement therapy can help with that. Some women may also need testosterone supplementation to help with lack of libido. But testosterone does have some side effects that a lot of women don't like. It can cause facial hair growth, deepening of the voice a little bit, and it's not as tolerated by some women. So that's why some women will go into bioidentical hormones, which are the creams that are given, because the testosterone cream is a little bit more tolerated with less side effects. So there are hormones that can be given for lack of libido. There are medications that can be given for that. The only FDA-approved medication for female hypoactive sexual response is the medication called Addyi, spelled ADDYI, and that is a daily pill that a woman would take to help improve her libido and her sexual response. But again, it is difficult to get covered because, in my opinion, the government and HMOs and all the insurance companies don't put enough value onto women's health.
A different episode.
Yes.
Well, what about one thing that our friend M here asked about was pajamas, sleeping.
Oh yeah, yes. I honestly don't have a decent answer for that, but I know that certain fabrics are going to be more comfortable to sleep in. I know that there are a variety of products out there for cooling measures. So you can have a pad that you can sleep on, like a sleeping pad that's supposed to be a cooling pad. You have these mattresses and pillows and bed sheets and pajamas that are meant for cooling. So I think it's going to be trial and error. I don't think there's any one particular thing that, from a doctor point of view, that we would recommend. So I see products advertised all the time. Um, yeah.
I agree. I think that the only comment I have is fabrics. In general, cotton. Cotton is a very breathable fabric, doesn't tend to retain the heat, and so that's kind of what you want against your skin if you have a tendency to run kind of hot.
Another question, but it's probably for a different episode. Yeah, they say like silk pillows for your skin, your face. Is that anything?
I actually think there's some mild support for that just because it's smoother, but silk versus satin and that type of stuff, I couldn't tell you. I don't think
Yeah.
it's something that's a huge event. And if it's making you too hot, you should probably just stick with cotton. And then cooling your room. That's the other thing too, is cool the room. Whether it is, air conditioning, whether it is a fan or opening windows or whatever it is you need to do to adjust your environment.
You see that? Margaret, you got a question?
I do, and this may go in that ridiculous category, but red light, using red light before bed. I mean, I'm trying that now as one of my things, but I'm confused on it because if I'm laying on my bed in bed and I have the red light on, my tendency is to close my eyes, do some breathing, and so forth. But then I was thinking, should my eyes be open to absorb the red light? And
is this red light for sleep?
For sleep, yeah. And so that was another thing I came upon. A couple of my daughter's friends, mothers are using it. I even purchased a device, but then I went ahead and just put a red light, red bulb in one of my lights. So do you have any knowledge of that or what that can do for me or for any of us?
I do have a comment, but I'm going to see if Dr. Ray has anything to say first.
Okay.
Well, I think the red light has been shown to have the least impact on melatonin suppressions and may help support a little bit more of the natural sleep rhythms. I think the red light therapy, they recommend like 30 minutes of the low intensity red light before bed to help improve the sleep quality and duration. It'll help support and improve the mood and the sleep function as well. But I don't think there's enough evidence for it. Not as strong as evidence as using hormone replacement or cognitive behavioral therapy, but it's low risk enough that it's something that you can try and see if it helps improve it. So, using that red light in the bedroom and in the bathroom or wherever, you get exposed to for that nighttime lighting is good. And then again, back to avoiding the screens. So you don't want to have any screens for at least an hour before you go to bed so that you use that red light ahead of it. But there's not any, I think, strong evidence or not anything high enough that I would recommend it as something to try. I think, if you're interested, then try it. If it helps, great. But otherwise, there's not much evidence to say that it improves the sleep.
Okay,
Yeah,
thank you.
I agree. I think it's kind of like, it's not so much. So once again, I agree 100% with Dr. Ray. I don't think there's a whole lot that supports this as the solution to everybody's problem. Having said that, I think that, rationalizing it from the science, I think it's just it's the lack of the higher frequency light waves as opposed to the lower frequency red. Kind of like, it reminds me of the old fashioned film processing where they're always in like a room with a red light. And so you're just eliminating that from stimulating your brain so that hopefully it'll help you sleep.
Blue light from phones and tablets and TVs and
Yeah.
you have the LED light bulbs in your rooms, those types of bright lights that you're always looking at, those can suppress your melatonin, which, can make it harder to then fall asleep. So if you're on your screen right before you go to sleep, it can affect your sleep pattern.
Yeah.
So they've shown that the red light has less impact on the melatonin levels. So it can potentially lessen that effect and help to support sleep.
Yeah, a simple way to look at it would be like with blue light or the higher frequency light wave that's in white light, which does have some blue in it, and all these things is like your brain thinks it's morning, so your brain acts like it's morning. If that makes sense, because its natural source of that would be the sun, right? So human beings are not nocturnal. We would wake up with the sun and be exposed to sunlight, including how it affects our brains and throughout the day. And so the red light is the lack of that. And so, having that in the evening may help kind of improve, your brain is now no longer thinking it's out in the middle of the day, if that makes any sense.
But it
And I
wouldn't
think that's really helpful, but it's not like you're not about shining that in your eyes. That's not the point.
Okay.
It's just
No.
that your environment is lit with
Red.
lower frequency red light spectrum light, if that makes any sense.
Got it. Oh, we got a
Thank you.
question from our friend S here, who's always quiet. Go ahead, S.
Hello. Can you guys hear me? I think
Yes, yes.
okay,
yes.
perfect. This is not quite an HRT question, but I notice more and more that beauty products are starting to get on the bandwagon of adding estrogen to their product lines. Is this safe, especially when you mentioned that when estrogen is not used in combination with progesterone, there could be weird effects?
So I haven't heard about people adding beauty products having estrogen, but I have heard women using the Premarin vaginal cream as a face cream, and to see that improvements in their skin for that. But again, yeah, I mean, if you're using any kind of estrogen on your body or in your body, and you still have your uterus present, you should be using a progesterone. So I'm not familiar with the beauty products putting estrogen in their products. I would think because it's a hormone and a medication, it would have some regulation, but I would have to look at that. Yeah.
I've heard of this. I think it's I don't know if something where you can buy an estrogen cream where I'm like over the counter, like, a face cream with estrogen in it. I haven't heard of that. I hope that once again, because it's a hormone that should be regulated, I don't think that's good.
It's not something in the U.S. I highly doubt it would be here. So it's probably something that's available outside the U.S. where
Oh, that's true. Or just something that people are doing. They're getting, vaginal estradiol and they're using it on their face. I have heard a little bit about this. The thing with it is I think once again, Dr. Ray, feel free to correct me. Like when I have somebody who has just vaginal dryness, I don't have a problem giving estradiol cream to use intravaginally without progesterone, because that is not really considered a systemic hormone treatment. It's considered a local treatment. And so I don't know if transposing that to the face would be any different. And then I start thinking, well, if you're using it in your vagina and then you're also putting it on your face or wherever else, the backs of your hands and your neck. And now we've kind of gotten a lot of application, and now we may have a lot more systemic absorption, and that is more of a concern to me. So I would not do that without talking to your healthcare professional. I don't think there is any science to support doing so.
Right. And for the vaginal estrogens, I don't give a progesterone either, but I do titrate them. So I'll have them use so if they come in and say, I'm having a lot of vaginal dryness, a lot of vaginal itching, burning when I urinate, maybe some discomfort with intercourse, but I'm not having any other symptoms, nothing systemic, no hot flashes, mood swings, irritability, any of those, then a vaginal estrogen is a very reasonable treatment to help target the vulvovaginal area to help with those symptoms, what we call the genitourinary symptoms of menopause. And so I tell them to use the vaginal cream every day for 2 weeks. And then we go to every other day for 2 weeks. And then I try to get them down to using it just once or twice a week. So we kind of titrate it. So once we've given them the cream and the cream has helped with the symptoms and sort of rejuvenated that vaginal tissue, then we start to titrate them down. So they're on a very sparingly used dosage where they're using it maybe 1 to 2 times a week. And that's enough to maintain the vaginal health and give them relief of the symptoms. So again, that's how we do it vaginally. Now, if they're using it on their face, if they're getting a vaginal cream prescription for estrogen, but then they're using it on their face because they want to improve the skin collagen, hydration, the dryness in their face, the fine lines, the elasticity, all of those things that happen with aging, it might have some benefit to that. And I think, like I said, I've heard people use it, and anecdotally, they said that they've seen a difference. But it should not be meant as a daily cream to use because of the constant estrogen stimulation. So again, I don't think there's any scientific studies that have shown that. I don't know how they know how much estrogen is being absorbed if you're putting it on your face. If you're doing that, then you need to titrate down to where you're using it only once or twice a week. I think if you're using it once or twice a week, the levels would be low enough that your uterus would not be overstimulated and have the risk of uterine cancer. But again, it's something to talk to your doctor about. They need to, individualize it with you and see exactly what you're doing. And, you should never use medications off label for other uses. And if you do, you definitely need to be honest with your doctor so that we know what's happening.
I think we could close this out soon because kind of hitting in the hour. One question is, what happens when teenage 20-something, 30-something women get a hold of this and start using it?
For their face, the estrogen creams for their face. It's going to potentially be excess estrogen in their system that can throw off their natural hormones and have side effects. So it is something that you need to talk to your doctor about. And again, like I said, I don't think that this is something available in the U.S., so it might be something in other countries that they're using that is already built into the beauty brand of it.
Okay.
So, again, anything that, you use, you have to take it with a grain of salt and be careful because there could be many, many side effects to things.
And what if they get a hold of their mother's HRT medication and they start using it?
I mean, again, it's the same. It's the same. They could end up with side effects and end up with risk and complications to their overall health that can be potentially life-threatening. So
life-threatening.
Well, because estrogen, if you take estrogen, increases your risk of blood clots. So if you're taking your mom's, maybe your mom has a hysterectomy and you get a hold of her estrogen, and I don't know why a 27-year-old would want to take it, but probably because TikTok told her to. So if she starts taking excess,
Exactly.
if she starts taking estrogen by itself and she's not taking a progesterone, she's going to increase her chances of uterine cancer. And estrogen increases your risk of thromboembolic events, so she's going to increase her risk of DVTs and possibly pulmonary embolism. So, like with any medication, you're not supposed to take anyone else's medication. This is how we ended up with a lot of the narcotic drug usage. People were taking their parents, Vicodins. Their parent had a shoulder surgery and they had Vicodin in their medicine cabinet, and the teenage kid was sneaking in there and taking their Vicodins, and now the teenager is addicted to narcotics. So, just it's common sense. Just don't take a medicine that's not intended for you. Talk to your doctor about any medications that you're taking for possible risks and side effects.
Yeah, estrogen can raise blood pressure too. Just
Right.
to throw that out there.
Wow. Well, I think that concludes this episode. Thank you for this. Thank you for everyone with your questions, and
Thanks, everyone.
we'll stay tuned for next week's episode if you want to join us live with our silly questions and inquiries.